Hi everybody, our presentation today is on the effect of ultra-processed food intake on the risk of developing inflammatory bowel disease, presented by Lauren Averill, myself, Katie Erickson, and Ashley Van Buskirk. We hope you enjoy. Who else is intrigued by the effects of ultra-processed food intake in the development of non-communicable diseases such as inflammatory bowel disease? Well, so are we. Therefore, we chose to do our structured review on exactly this topic. We evaluated 6 primary research studies tracking hundreds of thousands of participants across several countries to examine the effects of ultra-processed food intake and its relationship to the risk of developing IBD. In this presentation, we will cover 3 of those 6 studies that best summarize the results and key findings on the possible relationship between our independent and dependent variables. Each of these studies is a prospective cohort and was published between 2021 and 2024. Next, we will discuss the background of IBD and ultra-processed foods, then the purpose of our review and the methods we use to collect and analyze the data. Then we will interpret the 3 studies included in this presentation and extrapolate the conclusions of the studies overall. Finally, we will discuss the study's applications in today's understanding of ultra-processed foods and IBD risk and what future research can still be done to make these applications more effective in the prevention and treatment of IBD.
Inflammatory bowel disease is an autoimmune condition characterized by chronic inflammation of the GI tract. It has 2 different subtypes, which are Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the GI tract, whereas ulcerative colitis more appears in the rectum and in the colon. This condition affects around 2.4 to 3.1 million people in the US, and it's characterized by symptoms of abdominal pain, diarrhea, blood in the stool, weight loss, fatigue, and a few other symptoms. There can also be more serious complications that come with this condition, such as toxic megacolon, malnutrition, nutrient deficiencies, and colorectal cancer. Its etiology is not fully known, but it's hypothesized that many factors might play a role, some of these being genetics, the environment, the immune response, and gut microbiota. And to diagnose IBD, usually there's a stool analysis, there could be endoscopies, colonoscopies, and blood work that is all done.
There is currently no definition of ultra-processed foods. However, one widely accepted functional definition comes from the NOVA Food Classification System. This system was developed by the Center for Epidemiological Studies in Nutrition and Health at the School of Public Health in the University of Sao Paulo, Brazil. NOVA defines ultra-processed foods as being formulated with ingredients from unprocessed or minimally processed whole foods combined with non-natural additives such as colorings, sugar and non-sugar sweeteners, emulsifiers, and sensory enhancers. They're designed to be durable, hyperpalatable, and ready to eat, and are energy-dense, nutrient-poor, and lack protein, dietary fiber, micronutrients, and bioactive compounds. They are generally characteristic of fat, sugar, and/or salt and include products such as ice cream, sugar-sweetened beverages, processed meat, and savory snacks. Consumption of ultra-processed foods have substantially increased over several decades, especially in developed countries, contributing to over half of the calories consumed in the diets of United States adults. They play a potential role in the development of non-communicable diseases such as inflammatory bowel disease, obesity, and cardiovascular diseases, highlighting the gap between scientific evidence and public knowledge and/or behaviors. Emerging mechanistic research suggests a link between ultra-processed food consumption and chronic inflammatory diseases. Specifically, some research indicates that additives such as the emulsifier carboxymethylcellulose have effects at the cellular level, promoting bacterial overgrowth, adherence, and invasion of the gut epithelium. And other additives may facilitate intestinal inflammation through mechanisms like microbiota disruption.
My name is Ashley Van Buskirk, and I am going to discuss the purpose of our review. IBD results in the need for patient lifestyle modification and changes in dietary habits. IBD patients have an increased risk of self-imposed dietary restriction, specifically to manage symptoms, which may be based on personal beliefs and misinformation. This may significantly impact overall health. Newly diagnosed IBD patients have significant psychological burden reflected in anxiety, depression, and quality of life. IBD is characterized as a disease of industrialized nations with increased prevalence in the developed world. Although the etiology of IBD has not been fully identified, increased incidence of IBD in regions undergoing westernization has coincided with increased ultra-processed food consumption. Changes in environmental factors, including diet, may contribute to IBD incidence. More knowledge is needed to fully identify these relationships. And our report critically evaluates credible epidemiological research to determine if there is a relationship between the consumption of ultra-processed food and IBD risk. For our structured review, we used Google Scholar to find peer-reviewed original research articles related to IBD and ultra-processed food consumption. Keywords utilized in our search were ultra-processed food, diet quality, quality of life, IBD, and epidemiological research. Our report primarily focuses on epidemiological research, which can demonstrate how diet affects risk of disease in certain populations of people. We included data from 2 prospective cohort studies, 2 observational studies, 1 retrospective cohort study, and 1 pooled cohort study. All of the research reviewed was published within the last 10 years, and we included diverse populations of people and groups of people and age groups. Our search was conducted from September 4th through the 11th of 2024.
The prospective cohort study by Lowe et al. Investigated the relationship between UPF consumption and IBD development. They collected data from both nurses' health studies as well as the health professionals' follow-up study, which concluded about 245,112 participants. They used food frequency questionnaires and organized the foods into 4 groups based on the NOVA classification system. And these groups were UMPs, processed culinary ingredients, processed foods, and UPFs. Participants also indicated biannually if they had been diagnosed with either UC or CD. For the results, they found that a higher consumption of UPFs was associated with a higher risk of CD, but they did not find this for ulcerative colitis. They also found certain food groups had a higher frequency of Crohn's disease, but not ulcerative colitis. And these groups were ultra-processed breads and breakfast foods, ready-to-eat meals, sauces, gravies, cheeses, and spreads, and these all increase the risk of Crohn's. And you can see this over on figure 1, which groups had a higher risk. What they did find was that there was an inverse relationship between UMP consumption and ulcerative colitis risk, but they did not find this for Crohn's.
In the prospective study led by Narula et al. In 2021, the relationship between ultraprocessed food intake and IBD risk was evaluated. Data was obtained from the prospective urban-rural epidemiology cohort comprising 116,087 adults aged between 35 and 70 years across 21 low, middle, and high-income countries between 2003 and 2016. Usual food intake was assessed using a baseline and at least one follow-up cycle food frequency questionnaire. Ultra-processed foods included soft drinks, refined sweetened foods, salty snacks, and processed meat. To measure total processed food intake, participants were grouped according to servings per day, where less than 1 serving per day was the reference group, 1 through 4 servings per day, and greater than or equal to 5 servings per day of ultra-processed foods. Figure 2 shows the result of ultra-processed food consumption with unadjusted, minimally, and fully adjusted confounding variable hazard ratios. After adjustments for the confounding variables and the alternate healthy eating index, it was found that higher intake of ultra-processed foods was associated with higher risk of incident IBD. In the fully adjusted model, a reference hazard ratio value of 1 was given to the reference group of less than 1 serving of ultra-processed foods per day. In the 1 through 4 servings per day group, the hazard ratio was 1.67 and the confidence intervals lie between 1.18 and 2.37. And in the greater than or equal to 5 servings of ultra-processed foods per day group, the hazard ratio was 1.82 with confidence intervals lying between 1.22 and 2.72 and an overall p-trend value of 0.006. In this study, the hazard ratios represent the risk of an event occurring at any given time between 2 different groups. A hazard ratio greater than 1 indicates an increased risk of developing IBD between the reference group or the less than 1 serving per day and greater than or equal to 5 servings per day groups. And the confidence intervals indicate with 95% certainty that the true hazard ratio lies between the 2 values. In this case, the hazard ratios, confidence intervals, and the p-trend values show statistical significance for risk of developing IBD and its specific diseases of Crohn's disease and ulcerative colitis.
Again, my name is Ashley Van Buskirk, and I am going to discuss one of the original research articles I reviewed, which was published in 2024, so it is recent research. The study prospectively investigated early life diet quality and food intake frequencies at 1 and 3 years of age with future IBD risk. So, early life is a critical time period for the development of the gut microbiome and immune tolerance. And so identifying associations between diet and subsequent IBD risk may be key in understanding the development of IBD. Dietary data was obtained from 2 Scandinavian birth cohorts, ABIS and MOBA. There were over 80,000 children with dietary data at 1 year of age that were included in this study. But I think it's important to note that less than 66,000 children continue to have dietary data at 3 years of age, and that may influence the outcomes demonstrated at 3 years of age. Diet quality was assessed using a healthy eating index and was also compared to the WHO or World Health Organization dietary recommendations for children. And food intake was assessed and converted to weekly intake frequency. Essentially, food frequency intake was modeled as food exposure. So if a child had more frequent intake of a specific food group, they had more overall exposures to a food group. Register-based data provided additional information related to potential confounding factors such as maternal age, household income, maternal or parental education, antibiotic use, amongst others. Now I'm going to discuss research findings. Across cohorts, they found that age at weaning for most children was from 4 to 6 months of age. They identified that low parental education was more common in children with low diet quality at 1 year of age in MOBA, but not in ABIS. So this was not true across cohorts. So identifying the relationship between low parental education, diet quality, food exposure, and IBD risk needs to be further investigated. Distribution of diet quality and food intake changed from 1 to 3 years of age with increased consumption of sugar sweetened beverages and fruit in both cohorts. If you have any experience with children, they begin to develop preferences as they age. And so perhaps 1-year-old infants do not have the same exposure to the outside world, ultra-processed food, in the same way that 3-year-olds do. High and medium diet quality at 1 year of age was associated with a reduced IBD risk. So early life diet quality may be an important factor in IBD risk. High versus low fish intake at 1 year of age was also associated with a reduced IBD risk. Again, early life diet and exposure to fish, which may be rich in omega-3 fatty acids, having anti-inflammatory properties, may modify the gut microbiome and immune tolerance in a favorable way to prevent future IBD. High versus low fish intake at 3 years of age was also associated with a reduced risk, but specifically a reduced risk of ulcerative colitis. Higher vegetable intake at 1 year of age was associated with a reduced IBD risk. As we know, vegetables provide fermentable fiber, which helps keep the gut microbiome healthy. And so that may have an important role in the prevention and development of IBD and early life diet. Having some versus no sugar sweetened beverage intake was associated with increased IBD risk. As far as sugar sweetened beverages, they calculate it as children having no exposure or some exposure. And they found that even some exposure, not quantifying that exposure, but some exposure increased IBD risk. And really, that was the only ultra-processed food specified in this study. They did not find associations between other food groups and IBD risk. If you look over to the figure, they also looked at intake frequency of meat, dairy, fruits, grains, potatoes, and sugar and fat dense food. But they did not identify associations there. And then in adjustments for formula intake, household income, and antibiotic use by 1 year of age, those other confounding or potential confounding factors, the results remained unchanged. So those did not influence IBD risk.
In conclusion, most of the studies found that high UPF intake was associated with a higher risk of developing IBD, and that reducing intake of UPFs may help with decreasing intestinal inflammation and symptoms of IBD. They also found that early life is a critical period for the development of the gut microbiome and immune tolerance, and that diet quality and food exposure may prevent or contribute to subsequent IBD risk. An application from some of these studies is that these results may influence nutrition advice for those with IBD or at risk for developing IBD. And more research needs to be done on the constituents of UPFs that contribute to inflammation and alteration of the gut microbiome so that they can figure out what it specifically is in the foods that's leading to this development of IBD. And more research needs to be done on the role of UMPs in altering the gut microbiome and how the gut microbiome composition can influence IBD risk. Thank you.